Did you know that a simple bowl of blueberries could offer powerful inflammation support for aching joints? For generations, these vibrant blue gems have been cherished in both kitchens and traditional medicine cabinets, not just as a delicious snack, but as a natural ally against joint pain. If you're living with arthritis, osteoarthritis, rheumatoid arthritis, or stubborn joint pain, you know the daily struggles. Stiff mornings, burning inflammation, and the constant worry that each step may hurt more than the last. Finding safe, effective, and natural coping strategies can feel overwhelming. Blueberries have earned their nickname as nature's anti-inflammatory for joints for good reason. As inflammation lurks at the heart of most joint pain and cartilage wear, researchers believe certain foods, especially berries, can help combat these sources of discomfort at a cellular level. Traditional healers from Native American tribes, Ayurveda, and even early European folk medicine have long turned to blueberries for their cooling, inflammation-soothing properties. In traditional Chinese medicine, similar berries were used to promote circulation and reduce painful swelling, centuries before modern science would catch up. So what makes blueberries so formidable? It's largely thanks to their high levels of anthocyanins, a type of polyphenol antioxidant responsible for their deep blue color. Researchers have found these compounds can help neutralize free radicals and reduce the cascade of inflammatory processes that target the joints. Blueberries also contain vitamin C, manganese, and smaller amounts of omega-3 fatty acids, all vital for joint and cartilage health. Anthocyanins have been shown to block the production of pro-inflammatory cytokines, chemical messengers that amplify swelling in conditions like arthritis. By calming these signals, blueberries may help minimize joint tenderness and support a healthier inflammatory response. Recent clinical studies published in the Journal of Nutrition and reputable arthritis research journals found that regular blueberry consumption was associated with a reduction in both perceived pain and morning stiffness in adults with osteoarthritis and rheumatoid arthritis. Patients reported easier joint movement and less reliance on painkillers when blueberries became a habit. But the benefits don't stop there. There's evidence indicating blueberries support cartilage health by reducing enzymes that break down collagen and by nourishing the tissues that support flexible movement. In laboratory studies, blueberry extract reduced cartilage degradation, giving hope for maintaining mobility longer. A 2018 double-blind study found that osteoarthritis patients who consumed blueberries daily for 4 months experienced significant improvements in pain scores and daily function compared to a placebo group. Rheumatologists and nutritionists are increasingly recommending blueberries as part of an arthritis-friendly diet, based on findings like these. Here's a bonus. Blueberries' anti-inflammatory actions go well beyond the joints. They foster better gut health, may help balance blood sugar, and support cardiovascular wellness, crucial for anyone managing chronic inflammation. So what can you realistically expect? While some people report less pain and stiffness within a few days or weeks, best results typically appear after consistent inclusion in your routine, often within 3 to 6 months. Unlike a painkiller, the effects are gentle and cumulative, supporting long-term health. It's important to note, blueberries are not a cure and are not meant to replace your arthritis medications. Think of them as a complementary tool, one that may allow you to use less medication, reduce side effects, or simply feel better day to day. Always talk to your doctor before making changes to your medication. Imagine waking up with less stiffness, enjoying smoother walks, or returning to hobbies you've missed, all thanks to a simple dietary addition. Many people find that blueberries are an easy, affordable, and even enjoyable way to make daily movement less daunting. How can you make blueberries part of your day? Enjoy them fresh as a snack, stir into oatmeal, blend into anti-inflammatory smoothies, or sprinkle over salads. Both fresh and frozen blueberries retain their beneficial compounds. Only avoid syrup-packed or heavily processed versions. A daily serving of 1/2 to 1 cup, about 75 to 150 grams, is a great starting point. For best absorption and to help with morning stiffness, try enjoying them with breakfast or as part of an anti-inflammatory meal. Consider pairing blueberries with other arthritis-friendly foods, like leafy greens, fatty fish, olive oil, and nuts, as part of a Mediterranean-style diet. These combinations work together to amplify anti-inflammatory benefits throughout your body. Choose organic blueberries when possible to minimize pesticide exposure. Frozen blueberries are an excellent, cost-effective option that often contain just as many antioxidants as fresh picked. Store them in a cool, dark place or your freezer to preserve their potency. Although blueberries are very safe for most people, they may slightly thin the blood, which could interact with blood thinners or anti-inflammatory drugs. Consult your healthcare provider if you're on warfarin, NSAIDs, or immunosuppressive medications. Side effects are rare, but excessive consumption could cause digestive upset in sensitive individuals. Start with small amounts and monitor your response, particularly if you have food sensitivities or a history of low blood sugar. Try tracking your pain and stiffness levels weekly. Use a simple diary or mobile app to monitor how your symptoms evolve as blueberries become a regular part of your anti-inflammatory approach. Maximize results by combining blueberries with gentle, regular exercise, joint-friendly movement like swimming or Tai Chi, and other physician-recommended lifestyle habits. Every small choice adds up to better joint health. One common myth: blueberries alone can cure arthritis. The truth? They're a supportive tool, not a replacement for medication or professional care. And remember, no single food, no matter how powerful, works in isolation. How have blueberries or other anti-inflammatory foods helped your joint health journey? Share your experiences or questions in the comments below. Your story may empower someone else. Remember, every small positive step matters. Whether it's today's breakfast or tomorrow's gentle walk, you're building resilience and comfort, one choice at a time. In summary, blueberries offer an evidence-based, delicious, and affordable way to give your joints extra support alongside your prescribed arthritis plan. They can't cure or reverse joint disease, but they can absolutely add value to your overall strategy. If this video helped you, please like, subscribe, and share it with a friend who might benefit. And keep an eye out for our next episode packed with more trusted natural arthritis care tips. This is educational content, not medical advice. Never stop prescribed arthritis medications without consulting your doctor. Always speak to your rheumatologist or physician before adding new supplements or major dietary changes. Individual results will vary. Curious about another joint-friendly superfood? Stay tuned as we reveal how turmeric could become your kitchen's next anti-inflammatory champion.